evening. Thanks for being with us on the Urban Debate this weekend. I'm Sahar Zaman. We're making a start on a brilliant note on the announcement that has just come in from the Government of India. We now have a date for the vaccination rollout. This is going to start from the 16th of January, and the date for this rollout that was decided after a high-level meeting that was chaired by Prime Minister to review the country's COVID situation. The Prime Minister here has also reviewed preparedness across all states and union territories. Remember, we've had a series of dry runs. The first dry run across 4 states, the second and third dry run that we had across the entire country. This was for this very purpose, to make sure that the rollout is smooth. The first to get the vaccine will be, of course, the healthcare workers, the frontline workers. We are in a short while just going to be giving you the total breakdown of what these categories are. But the phase 1 rollout is for 30 crore of our frontline workers here. And soon after this announcement, Prime Minister Modi took to Twitter as well in reiterating that announcement, calling it a landmark moment here for a step forward in India's fight against coronavirus. Remember, given our numbers and the scale of this rollout, this is not just going to be watched with keen interest and anticipation across India, but across the world as well. There will be several learnings for the entire world with this rollout. Going across to our correspondent first, before we go across to our experts with us here as well. But first to Ayushman, who's got us more details here on this. Ayushman, the preparedness for this has been in the works for several weeks now. January 16th is going to be that big test. More importantly also, of course, to make sure for all that preparation that has been done, the identifying of those who get the shot first, the rollout and plugging the loopholes, that this remains a smooth operation.
Yes, sir. And for that reason only, before this rollout, there has been several rounds of dry run that has been conducted in all across countries, and there are several states which have reported that there were some problems with the COVID app, and that has been worked out as well. The priority group is something that the government is currently focusing upon, and for that reason only, it was before written to the states that they need to prepare their own teams on ground. Be it the district level, nodal team, or the block level, the teams have to be prepared because the vaccine rollout will require massive manpower and also monitoring. As far as the beneficiaries are concerned, there are 3 core groups which are currently being focused. These are the priority groups. First is the healthcare workers who will be given the vaccine for free. The number all across the country is 1 crore. The second is the frontline worker. They are 2 crore in numbers. And third, and the most important for breaking the chain of mortality, is the priority age group of above 50 years and people who are below 50 years but are having comorbidities. Though the government has made it clear that it will be free for 3 crore of healthcare workers and frontline workers, it is still to make clear of the fact that what will happen to the 27 crores people who are there in the priority group above 50 years of age. Important aspect here, what we are getting to know from the Health Ministry is the fact that over 66 crore doses are to come in, are to be supplied to the states till the month of June. This is somewhere matching to the number of the priority group which we have, 30 crore. And given the fact that it is 2-dose vaccine, so somewhere till June, the priority group is to be vaccinated all across the country. And for that, the states have been told to be prepared not just for the vaccination, but also for the after effects of the vaccination if something occurs.
Okay. Ayushman, thank you for getting us those updates here. There are many detailed aspects here to this massive rollout. And we're going to be going across to our experts with us connected this evening as well. We have Dr. Rakesh Mishra, who's the director for the Center for Cellular and Molecular Biology in Hyderabad, Dr. Narendra Gupta, public health expert, and also Dr. Deepak Natarajan, senior consultant, interventional cardiologist and public health consultant with us. Thank you, gentlemen, for being with us here on this brilliant update here that has come in for our country. First to you, Dr. Mishra. on how important and closely watched this development is going to be here. We've had multiple rounds to a certain to a certain preparedness here, but given the numbers that we're dealing with and how this is going to play out on ground, your first concerns on this.
So it's a unprecedented exercise, which is in response to unprecedented situation that we are facing in this pandemic. And I think there have been reasonably good, solid preparations for this. Now, app is there, and priority groups are set, and rollout is all there to start in few days. One good advantage is already certain dry runs have been done, so there is some experience for the people, and even more next the first group that will be taken for vaccination are the healthcare workers who are much more informed, and there will not be much of confusion, I assume, and that gives the opportunity for the healthcare workers, those who give the vaccine, more real life experience, real time experience of actual vaccination, and if there are above certain numbers of reactions or something to be monitored. And then the 2 crore frontline workers, I think by the time we reach there, we will be all well set to really for smooth vaccination. But it's an extraordinary exercise, and I think proportionately well prepared, and hopefully it will go well because people will look it at a positive development and some relief from the this pandemic that we have been going through for about a year now.
That's right. Dr. Gupta, in the calculations here that are to keep in mind, we have 30 crore identified who will be part of first phase of this mass inoculation here. It's going to take a terrible lot of time. It would take weeks, months, as per your calculation here. We could perhaps be hitting mid-year already to be completing phase one, to be completing all the top priority health workers and frontline workers here before we move on to the next.
Certainly, yeah. See, it's going to be a huge challenging task, undoubtedly, essentially because the first group, which is of the frontline health workers and all the health workers, which are about 10 million of the total, they are all part of the organized, both in the public and the private system. So it will be not such a huge challenge to vaccinate them because they already part of the health system and somewhere and sometimes they are always linked to this whole management and mitigation of the pandemic. The second section again of the other frontline workers, which is about 2 crores, that will also be again from the organized sector, so it will not be a difficult thing. They are all educated people, they already are aware about the issues, so it will not be a tough thing. The real challenge will emerge when we get to the community and these persons who are above 50 years or persons who are of less than 50 years with comorbidities. That is the time the real challenge will begin. But we would begin to find out what are the shortcomings they are going to be during the vaccination in the first round itself. Some of the things which have emerged during these dry runs which were done, these 3 rounds, one of the issue which has been flagged by most of the health workers is about the connectivity and uploading the data about vaccination. That is one thing they have been talking about it regularly. And that too with only 1 crore people, if it has to be done, there are numerous sites, vaccination sites, because the plan is to vaccinate about 100 people at one site. If that is so, then to vaccinate 1 crore people, you require huge number of sites and to man them, to staff them with adequately trained people would not be all that difficult, at least for the health workers. But once we move on to the other territory, it is going to be a huge challenge. That is one part. But then ultimately, when the vaccination begins, we have to cover the our entire population as quickly as possible, because our purpose is to prevent infection. Our purpose is to reduce mortality. If these two objectives have to be met,
Right.
then we have to find a way out to prevent to vaccinate as many people as possible as quickly as possible. Otherwise, it may happen that you begin to vaccinate one batch, and by the end you reach to the last group of the people. These people might have lost their immunity and they are again available for vaccination. So all those kind of issues still are unclear into in this whole process.
Right. All right. So you're of course talking about the 6 month cycle here. That if we give 6 months to those who've been vaccinated, do they still retain the immunity to fight beyond 6 months, or would they need yet another round of vaccination? Of course, those are the challenges, and we would keep learning on those as we move ahead. Dr. Natarajan, in what you have observed from the findings of the dry run, this is going to be more manageable in big metro centers, or have we managed to plug those holes even in tinier areas at the district level here as well, which has been the focus even during the dry run?
No, I think we have reasonable experience with mass immunizations. We have a long history. We did the polio vaccination program, so we have the expertise, and we also have the experience. So there will be difficulties, there will be challenges, but they have to be overcome. As Dr. Mishra has said, this is an extraordinary situation which requires extraordinary measures. So let us hope for the best, and I'm sure we will manage. We need 2 shots. Remember that for both vaccines, you need a second shot for the booster. So therefore, we have to have 60 crore shots. So I was calculating, my calculation is that if you do 5 crores in a month, then we will manage 30 crores in a year. So that's it. I think we have to, I am hopeful, and I'm quite optimistic that our people will be able to initiate and implement this immunization program.
Right. Dr. Mishra, a very major role is going to be played by the workings of the CoWIN app as well, which the government has fine-tuned further. Right now, we're looking at, of course, an internal registration on the CoWIN app concerning our priority group of healthcare, frontline, and municipality workers here. But for those who are within this group here, to further be upgraded onto this, largely going by your understanding, is 30 crore the accurate estimate, or we could be looking at several more who are still not on that list?
Yeah. It is 30 crore, I think, is a very good number. You can have any list. We just heard that even if you do 5 crore a month, we are going to have 1 year for this. So we know we have to, in the end, to really get over this, we need maybe something like 50-60 crore people to be vaccinated. Not considering that some seropositive which may already be there. If it's possible, we should vaccinate them also, even if they have been infected and recovered, because that helps the proper resistance against the virus. So that, I think, will happen. This number will increase as the availability of the vaccine increases, as more private players come into vaccination, maybe at certain point of time. Once this app becomes, the app is going to be the most crucial thing, because you have to follow people for multiple reasons. One is that you have to vaccinate
Yes.
them after 4 weeks, and you cannot delay it too much. You should not lose them from your radar, that now you don't find in one shot they've taken and disappeared, which is very much possible here. So that's why apps have to work well, and we should be able to track people. And suppose that more than one vaccines are being administered, so second dose should be the same vaccine and not they go to another city and take another one. So those are practical considerations that will require a huge management logistics for this vaccination program. But as I said, we do elections, we do many things at such a large scale, which is extraordinary, and we have a vaccination
Yes.
experience. We have the largest, in fact, vaccination experience ongoing in the country. So all these things will play out, and I think it should be all right. But the number, we can calculate and put any number, but what we have to see is how many we can actually vaccinate in proper way and follow up, not only for second vaccine, but also what happens after that. Is anyone getting reinfected after 3 months, after 4 months? And we have to convince people not to drop the mask or anything, because remember, these are not approved vaccine. These are emergency use
Right.
approvals, which means we do not know after 4 5 months what will happen. So, and in any case, it takes a month and a half or something for, even if it is a immediate resistance to or immunity to kick in. So all these things has to be properly explained to people so that they don't become totally indisciplined after taking one shot or even after taking two shots. So I think vaccination in effect is one thing, but the other part of the management is more challenging, I will think. And also the big advantage which I look from this program is that we are going to digitize public health system, monitoring of the health of individuals at this scale, which is going to be really a major gain for any
Right.
further not only follow up, but general healthcare system for the country. It will be big advantage and lots
Absolutely.
of positive that will come out from this.
Right, that is something we had started with the beginning of the Arogya Setu app here as well. CoWIN is the next step here to have things on digital record. Dr. Gupta, in an important aspect of learnings from across the world here. We've had a lot of long queue chaos that we've seen in the United States at the first round when the rollout had taken place here. In your opinion, what should be the learnings from that in helping us avoid a play out of that in India? Because we're dealing with several thousand more in number here.
As per my experience, I could say that uh, we perhaps may not experience that kind of a scenario here in India for a number of reasons. One of the reasons is that based on our experience of this mass vaccination, which we have been doing since last several decades on polio and on DPT and BCG and so on, our experience is that to get to people for vaccination is a massive exercise. In fact, there had not been any instance here in villages of India where people have come on their own for vaccination. So, getting people for vaccination is one of the most challenging thing which we are going to experience for two reasons in COVID, because a large number of areas, especially in villages, have not experienced people getting infected with uh, COVID, and at the same time, no mortality. So generally, even if you persuade people who are above 50 years or those with comorbidities, though large number of people here in India, especially in rural areas, have remained undetected even if they have comorbidity, because they have not got investigated, their tests were not done. That is one thing. But the other thing is that they may have these kind of
Okay.
questions in
All right.
mind that why 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 should we get ourselves vaccinated that COVID has not come? And that is what I keep hearing, because I work a lot in the villages, that I keep hearing that when corona has not come here, why should we even have a mask over our face? Why should we be not meeting people? Why should not be gathering? That is one part. The second part is this, that they may have some kind of
Absolutely.
a physical issues in terms of getting to a distance, because vaccination sites cannot be in each and every village. So people have to walk to a vaccination site which may be few kilometers away from the place where they live. and especially people who are above 50,
All
if they
right.
have to
So it's going to be it's going to be a challenge of what you're saying, Dr. Gupta, here as far as further interiors into the country here are concerned. Dr. Natarajan, final point to you. In the time that has been allotted at vaccination centers, approximately 45 minutes per person, and then monitoring that needs to be done, keeping track whether the person would come back for the second dose, which is extremely crucial to seal the vaccination process, to say that you have successfully been administered upon. To what extent is that a challenge to be ensuring people are coming back for the second dose?
No, you've already mentioned that you have this app, right? So you've put in the data in that app, then you have the information about all individuals who have received the first shot, and then you call them again after a month. So that should not be a problem. And why would you need 45 minutes to vaccinate a single individual? You vaccinate a person in a couple of minutes. You observe the person. Yes, you observe the person for at least 15 minutes or 20 minutes or maybe even half an hour. But if 100 people come, I would do it myself, or I would tell my assistant or the nurse to give the shots one after the other. And then some people can, our staff can keep a track. So that's how this is going to operate. So it's not a big, it's not a huge physical problem or a logistic problem. You understand? 10 people come in, you give them the shots. Well, the injection is a very small one. It's a very tiny injection. It's just half a cc. It's an intramuscular injection. It can be given in the arm or it can be given in the thigh. So it's not a very sophisticated procedure. It's quite a simple procedure. So it should not be a problem.
All right. Absolutely. These questions, of course, asked and discussed with you have been some of those that as concerns that have been raised by our viewers in the past several days. Have been discussing this on a daily basis. Many thanks for being with us tonight. Appreciate all our experts, part of our panel here, in answering essential curiosity that now there is regarding the rollout of the vaccine. But we need to keep in mind here that this is just the start. Starting 16th of January, we first need to take into account a huge population of our frontline healthcare municipal workers of 30 crores. Till that list is done, it is going to be taking several months for that to conclude till it finally comes down to us. And in that intervening time, we have to behave as responsible citizens. 16th of January doesn't mean we drop our masks, we drop social distancing. This is to remain a part of our lives for months and months to come, vaccination or not. But let's keep our fingers crossed on keeping safe and looking at this as a historic, smooth rollout that the world will be watching here in dealing with these large numbers, in all that has been put in place and our preparedness here for the rollout. Thanks for being with us tonight.